Thank you, Governor. Good afternoon, everyone. Thanks for being with us again today. I'll start by giving a very brief snapshot of our numbers for the day. We have 53 new COVID-19 cases to report today. There are currently 81 people with COVID-19 hospitalized in Rhode Island. Of these 81 people, 8 are in an intensive care unit, and 5 of those 8 are on a ventilator. As I said yesterday, these hospitalization numbers have been stable over the last 2 weeks. Sadly, we do have 2 additional COVID-19 associated fatalities to report. One person was in their 60s and one person was in their 70s. Our sympathies and prayers are with the families of these Rhode Islanders. The governor gave a great overview of testing. Some keys for you to know is that Rhode Island has a comprehensive statewide approach to testing with a dedicated phone line specifically for K through 12. That is an excellent approach and really contributes to the planning and structure that we know is critical to overcoming COVID-19. It's the similar planning and structure that we've spoken of with childcare, and it's the same approach that we are bringing to K through 12. I want to follow up a little bit more with this information about someone who has symptoms and how we are handling it. Again, applying the planning and structure approach, we have been very thoughtful in helping to differentiate when a child or staff person has symptoms. There are 2 categories. That person may have the types of symptoms that make it more likely to be COVID-19. Those persons we are referring to as being a probable case. Let me talk for a few minutes about what a probable case of COVID-19 means. We consider it based on the types of symptoms that they have and have determined it in alignment with public health guidance overall based on what is most likely to be associated with COVID-19. Someone could be considered a probable case if they have any one of either of these symptoms: a persistent cough, shortness of breath, difficulty breathing, or recent loss of taste or smell, which is something that is unique to COVID-19, as we've been learning over the last several months. Someone only needs one of those symptoms to be considered a probable case. Someone can also be considered a probable case if they have any 2 of these following symptoms: fever, chills, muscle aches, headache, sore throat, nausea, vomiting, diarrhea, fatigue, congestion, or runny nose. Again, for this second set of symptoms, someone needs to have 2 of them to be considered a probable case. Evaluating symptoms in this way to define a probable case is an approach that we've taken that's consistent with public health guidelines, and it helps add structure to how we are going to approach the many different compilation of symptoms that can occur, particularly during these winter months. We need to be able to understand who is more likely to be at risk of having COVID-19 and how can we help accelerate our response to them. So if someone has symptoms that fulfills a probable case, either while at home or at school, the way the governor described, they will be asked to engage with the scheduling hotline specifically for K through 12 so that they can get tested and we can make determinations about how to handle that individual as well as the close contacts to the individual in the classroom. Because of the rapid testing system that we know has been critical, and we are probably one of the few states that has one as comprehensively set up as we do, it's going to allow us to respond quickly. One of our focal points is to minimize disruption to teaching and learning in the classroom. So if someone is a probable case and has symptoms, getting the test as quickly as possible and getting the results as quickly as possible allows the Rhode Island Department of Health, in partnership with the Department of Education and the school and school district, to minimize disruption to the classroom, wait to get those results, and then make a determination about how to respond once the results are back. If the results of someone with symptoms returns positive, we're able to ensure that that individual can quickly be isolated and recover safely at home, away from other kids and other students and staff. And we can work with the close contacts of those individuals to help them be quarantined. And the students who need to be home for that can continue their distance learning from that perspective. If someone returns with a negative test result, they still need to not be in the classroom because they have symptoms. Anyone with symptoms should not be in the classroom. They can recover safely at home, do distance learning, and as soon as they are fever-free for at least 24 hours, with no medication to reduce their fever during that time, they can then return to the classroom given the evidence of the negative test for someone who has symptoms and fulfills criteria of a probable case. This is just one example of the comprehensive and thoughtful approach that we will be taking. And all of what the governor shared and what I just shared is already publicly available in our K-12 playbook. It walks through the different scenarios of how we are handling someone who has symptoms that fulfills criteria for a probable case. It's important to know that regardless of what we have written in the K-12 playbook, the Rhode Island Department of Health stands waiting and ready to engage with the schools and make sure that we are supporting them and walking them through every case. The playbook is there so that you have a sense of the pathway that will be taken and parents can understand what will be taking place, but you can also know that the Rhode Island Department of Health will be by your side helping to ensure that each individual case is handled the way we need it to be, because there can sometimes be nuances that occur. So this is the way to be able to show we have a comprehensive, thoughtful approach that involves planning and structure. We've made it publicly available so you can dig in and learn and have a sense. And no matter what, each time the Rhode Island Department of Health will be guiding every step of the way in partnership with our colleagues at the Department of Education. All of this information has been and will continue to be communicated to schools, but I wanted to take a moment to explain it here so that parents and families understand the tremendous amount of work that's gone into our planning and the structure that's in place as we're approaching reopening schools safely.